Hey doctors and my fellow friends, we are group 1 and now we are going to present the artificial lens which is called pseudopiacals. My name is Dong Huiying and my other teammates are Ricky, Itong, Tasnim and Shifa. Firstly, I will introduce about what is pseudoplasca. Pseudoplasca came from the Latin word pseudo means artificial, piacals means lens. In general, we are called it artificial lens or fake lens. An artificial lens implanted in our eyes to replace the own natural lens during the cataract surgery. Normally, during the cataract surgery, laser is used because it is more safety and faster. The implanted lens during the cataract surgery is called intraocular lens (IOL) or pseudopiacals (IOL). Before during the cataract surgery, doctor will measure the length of your eyes and the curve of cornea to set IOL's focusing power. Because IOL comes in different focusing powers depends on the people's eyes. Why we need a pseudoplasca? We need a pseudopiacals IOL if you have a cataract removed. Cataract is a clouding of the lens that can cause blurry visions and increase the glare from the light. The lens helps to focus the light onto the retina. Retina is a layer of a light-sensitive tissue in the back of your eyes. As we get older, protein in our lens become clumped together and form a cataracts that cloud our visions. The more the cataracts grow, the blurry your vision will become. Cataracts become very common as people getting older. By age of 80, most people will have cataracts and need to replace the clouded lens to restore a clear vision. The symptom that you may need a pseudophakia IOL is you are having a cloudy or blurred visions, faded colors, double visions in one eye, and you need for brighter lights when you read or doing some close-up activities. If you are having this type of symptoms, you better to see a ophthalmologist. These are the biomaterial used in making the pseudoplasca. Polymetal metasilate (PMMA) is the first material to be used successfully in making intraocular lens. The general name of PMMA is called acrylic or acrylic glass. Silicone and acrylic glass are soft folded insert material that allow the lens to be folded and insert into the eyes through a smaller incisions. The another materials are polymers. Polymer is a combination of collagen and polymers that used to make the lens because it is advanced and thin and clear lens that functions similarly to the contact lens. That's all for me. Thank you.
I'm Ito, and now talk about the properties of biomaterial used in pseudophakics. First, all materials are biocompatible. That means they do not react with the body or produce allergic reactions. The biomaterials do not break down over a person's lifetime and do not need to be replaced. Besides that, the intraocular lens is easy to implant in the eyes because of the soft and flexible structure. By using the suitable biomaterials, users will feel natural in the eyes. It can also provide ultraviolet protection while letting natural visible light to pass through it unaltered. Moreover, soft foldable inner materials such as foldable hydrophobic acrylic and silicone foldable intraocular lens allows the lens to be folded and inserted into the eye through a smaller incision. However, there are some advantages and disadvantages for each biomaterial used in the intraocular lens. For acrylic, the advantages are excellent optical clarity, which means that it is optically clear and it provides excellent weatherability and resistance to sunlight. Besides that, it has high water content, and due to this reason, it has lower refractive indices and therefore are thicker lenses. For normal acrylic lenses, they are rigid, that means with good impact strength, but the incision size needs to be at least as big as the diameter of the intraocular lens. Furthermore, the incision needs to be so sharp, and this may induce post-operative astigmatism. For silicone intraocular lens, it has similar advantages to the acrylic. It can resist to hot and cold temperature. It is flexible and has a very hydrophobic surface that resists posterior capsular opacification. Posterior capsular opacification occurs when a cloudy layer of scar tissue forms behind your lens implant. The disadvantages of silicone intraocular lens include the discoloration and calcification associated with certain eye conditions. That's all from me. Thank you.
Next, we'll be looking into the application of artificial eye lenses. So, once the natural lenses in the eye has been removed, the eye loses its ability to focus light and images clearly onto the retina. Before the development of artificial lenses, we have to use hard contact lenses as well as very thick eyeglasses to correct our visions after cataract surgery. Artificial lenses is usually placed within the lens capsule, which is the small sac or membrane that once enclosed the natural lens and held it in place. Firstly, we have the monofocal lenses, which only provides one type of focus or clear vision. Monofocal lenses also provide clear vision either at distance or near, but never both. Then we have the astigmatic lenses. The astigmatic lenses can correct astigmatism. The astigmatic lenses may also reduce the need for an astigmatism correction in the patient's eyeglasses after surgery. Then we have the multifocal lenses. The multifocal lenses provide more than one type of focus or clear vision. It also provides clear vision both at distance and near simultaneously. The multifocal lenses can correct both distance and reading vision. It can also reduce the patient's dependence on eyeglasses and also contact lenses.
Okay, next I will explain about the safety issues of artificial lenses. Usually, people who wear the artificial lenses will experience this type of issues. The first one is corneal edema, or the swelling of the eyes. Next, it will increase the eye pressure because jelly-like substance is facilitate the placement of IOL. And also they will experience retinal detachment because it allows ocular fluid to sit behind the retina, and they will experience flashes in field of vision. They will also experience dislocated of IOL, infection, or maybe bleeding inside the eyes, and they will have droopy eyelid.
Hi guys, I'm Ricky. Please allow me to introduce you to the latest technology about artificial lenses. For many years, researchers are trying to invent something called artificial eye, and recently they have successfully invented that by combining metalens with artificial muscle. And together they call it tunable metalens. Careful, it's not tunable, but it's tunable. Alright, so basically, in each lenses, because the lenses, as you can see, is really small, so the density of information is really high. So they have developed an algorithm to shrink the file size and to make the meta lens compatible with the technology currently used to fabricate integrated circuits. And with this invention, right, they have proved that there is possibility to unite these two industries, which is semiconductor manufacturing and also lens making industry. On the right side of the slide, you can see that there's something moving. It's actually the artificial muscle. In human eye, the lens is surrounded by the ciliary muscle. And now since we are doing artificial eye and they need to do something to replace the natural ciliary muscle, and thus this artificial muscle comes out. And this ciliary muscle or artificial muscle is able to stretch or compress the lens and changing its shape to adjust the focal length. So it is to ensure that we able to capture the image very clearly. And they also choose a thin, transparent dielectric elastomer with low loss, meaning that when the light travels through the material, there is little scattering to attach to the lens. Again, it is to ensure that we are able to see clearly, see the image clearly. And also, the researchers have developed a platform to transfer and adhere the lens to the soft surface. Alan Shi, one of the researchers for the invention, has once said that we go one step further to build the capability of dynamically correcting for aberrations such as astigmatism and image shift, which the human eye cannot naturally do. Meaning that we have gone one step further to something even more bigger by inventing this technology, which is artificial eye. And so we have reached the end of our presentation. Thank you for watching and hope you have learned something. And that's all about it. Thank you. See you next time. See you next time.